Deputy John McGuinness, please.
May I firstly congratulate you, Minister, on your reappointment as Minister for Health, and to congratulate Deputy Shartle, who I know is passionate about the whole area of health, the committee and all of those that contributed to the work of that committee, and indeed those from outside the House that made their professional services available. That this report has now ended up in a debate in this House, I think, is a first step towards recognising that the politics needs to be taken out of health. We need to have one single focus, and we need to support whoever is the Minister for Health in achieving the type of reform that is necessary. So therefore, Minister, a lot rests on your shoulder, because you are now the one receiving this report, and you are the one that will have to action the report. Now, while others have said that the report requires you to make it, or you should make a statement rather, on your intent in relation to the report, that's quite true. But you will be judged by your actions, and I think that the sooner that you can take an action and a step in the direction of keeping this cross-political approach to the delivery of a better health system, then the better. Political agreement is hard to reach in this place, and indeed going back to '97 and that period when Mary Harney was Minister for Health, it was clear then that if political agreement had been reached, that some sort of peace would be established around the whole area of health, political peace, that we might have made far greater progress with the money that was being allocated to health at that time. It's never too late to start, and we have it now. But as good as that report is, there are many other reports that have been put in place by various ministers for health, hundreds of them I'm sure, that have never been acted upon and that never will be acted upon. And I hope that this particular report doesn't end up on the same shelf as all of those reports. So, what do you do to act on this report? The HSE is dysfunctional. I don't think it has the capacity or the ability to fulfil any part of this report. I think that the Department of Health has washed its hands of health a long time ago, and it creates that distance between the HSE and the Department of Health. You are the one that has to drive the reform, and therefore you are the one that has to find the method to be put in place to manage this change. I remember previous health reform packages that were talked about publicly, and Eddie Malloy was the one that said that you require change managers within the HSE to drive the change in terms of policy and direction that you're talking about. And that's where previous policy failed, and failed badly. So therefore, there is a need for a cohort within the Department of Health or the HSE that will drive this change that is necessary, that will pick the quick wins that we can have in relation to this report, implement them, and show by leadership that not only have we a report covering the next 10 years, but that for the pieces that are agreed upon and can be funded immediately, that you're going to have the managers of change in place to insist that all of this happens. So there's all of us in this House that have to agree on it. There is the health professionals that have to agree on it. And there is the trade union movement that has to contribute to changing the culture of resistance and to bring about the change that is necessary in cooperation with this House and the General Health Management to ensure that we get the best deal for the patients that we're all talking about. So where would I start? I start by that change management. But then I would take the simple things. I would look at the PQs that are put to health every day and look at the numbers of them that deal with single patients, that deal with the desire to get services for a patient and to bring about better outcomes. Hundreds of questions every single day. And what do we get? You answering the questions and saying, if you don't hear from the HSE within 15 days, give us a shout. Well, Minister, you don't hear from the HSE within 15 days. and you may as well be shouting in the middle of Croke Park, because nothing happens. And as a result of that, people have lost faith in their politicians, in the ability to change the system, and in the ability to get the services when and where they are needed. You have to stop that. And I would like to see you taking full charge of the parliamentary question system in this House. Because as you introduce accountability, real accountability, you will then get outcomes. So you'll have outcomes to your parliamentary questions. Tell the HSE to start by telling the truth at Public Accounts Committee and health hearings in this House. Tell them to acknowledge the wrongs early and stop the prolonged legal practice and legal established practice within the HSE to fight every single case, only to end up at the end of it by making an apology and giving out a heap of taxpayers' money, billions of euros being paid out on mistakes that were made within the HSE. And I accept that mistakes will be made. But do we learn from those mistakes? Well, not by the amount of money that I see being paid out on a year-to-year basis. It is colossal money. And how many people could be taken off trolleys if only that particular culture within the HSE was started? It's grand to do it because the taxpayer is paying it. So answer the parliamentary questions, deal honestly with committees, and you insist on taking responsibility for the HSE and for the change management. Primary care is essential to all of this. It's the cornerstone on which our better health services will be built. And every single statement from ministers refers to, and it will be conducted in the primary health care sector. But there's no money attached to it. The GPs are leaving this country in droves. One practice got in touch with me and told me that a GP of 30 years said that the health system is going down the tubes. We're having to face more work on an ever-depleting workforce. So we're educating our GPs to export them. That essentially is what's happening. And the GPs currently are pressed to their limits to try and deliver the services that they have, not to talk about the services that we, as politicians, want to see that primary health care sector deal with. The psychiatric services are at crisis point. They don't have the professionals within them to deal with the issues that they're being confronted with. Only recently, the Union of Students in Ireland gave us a presentation in relation to the health services and in relation to access for their students who are under pressure to access those services. If you access health services privately, on the 3-month period, one family, VHI covered it, €90,000. Nobody could afford it. And that's why, because of this, VHI and other private health care is going through the roof. There is no control. There is no transparency in it. There's a duplication of waiting lists. Best practice in orthodontics, for example, and in dentistry was highlighted. The two most prominent consultants in the country recommended change in relation to all of that. And you know what happened? They were deemed to be the people out of step, and they were the ones that were sanctioned within the department, and they are the ones that suffer to this day for wanting to make a better service. And they had a proven model working perfectly, but it didn't suit the HSE or the Department of Health, and they then ended up in poor health themselves. We've all been asked about Lyme disease and many other diseases. Nothing happens. Protests outside the gates. Nothing happens. So therefore, Minister, it falls to you. In the time I have left, I want to mention the sarcoma specialist, which I think is just incredible. 2 applicants for that job. How many people were on the interview board? 17. 17 people on the interview board for 2 applicants. And the foremost person in the world that was in situ, that was in place, did not get the job. Incredible. That's our health services, just because they wanted to do it their way. Scoliosis is the same thing. How many times have you been asked about it? How many times have you been asked to change it? How many young people are suffering because of it? So between now and the change in this 10-year plan, you need to do something. You need to make sure that those that are being paid huge money within the HSE being paid to manage, actually manage. Because people will tell you, if you get into the care, it's the best care that you can get. But yet, there is an imbalance in who is employed by the HSE. There's an imbalance in terms of the number of managers for years.
Thank you, Deputy.
You have to seek their cooperation to change that. And I'm asking you that in the context of this change, that you implement some sort of management between now and the time you take your first step in the process of this 10-year plan.
Thank you,
and I commend everyone associated with the report.
Deputy Hildegarde Naughton, please.